Nigeria takes step towards state police and amid growing security concerns.
Most of the states are in agreement with the establishment of state police in Nigeria. But today the council have decided to step down the discussion.
President Tinubu to unveil 2025 budget proposal amid calls for prompt submission.
Has indicated its intention to bring the 2025 budget proposals and estimates to a joint sitting of the National Assembly.
Federal government reaffirms commitments to achieving universal health coverage.
The key issue is whether to revitalize, whether to enroll. Somebody has to pay the premium.
And then good morning, Nigeria. Today we shall focus on accessing quality healthcare.
Good morning, Larry. It's like this weather is really hitting you hard.
Oh, well, I think I would subdue it.
Well, we're talking about health today, so don't worry. We'll talk about it. It is the desire of every Nigerian to receive quality and affordable health care without impediments.
Absolutely. And based on universal health coverage, everyone should have access to quality health services without financial hardship.
Unfortunately, Larry, most Nigerians are not captured in central and state healthcare insurance schemes, thereby limiting access to healthcare facilities.
Also, transportation challenges in remote communities affect access to healthcare facilities.
Yeah, Ray, and where many patients find their way to a healthcare facility, inability to pay for drugs and other services pose another big challenge.
You know, that's like, I really do not know what to say. Like, you know, people just say it is better to buy food now than to be ill and buy drugs because, I mean, none is cheap, but food is better.
But the best thing is to stay healthy.
Exactly. Anyways, you know, most of the healthcare facilities face infrastructure deficit for patients with physical challenges, like absence of lifts in high buildings.
You're right, and in addition to that, is also inadequate healthcare professionals and their attitude to patients deny many access to optimal health care.
And to improve access to healthcare facilities for Nigerians, the government and relevant agencies must invest in infrastructure.
Similarly, the government and other healthcare providers should increase the number of healthcare professionals to deal with the increasing number of patients.
Above all, government and other healthcare providers should strive to implement functional health insurance scheme. So today on the program, we shall examine access to quality healthcare in Nigeria. I'm Ray John. This is Good Morning Nigeria. Welcome to the program. It is the last for the week.
You're right. Thank God it's Friday. And I'm Ademola Adeye. Thank you for joining us this morning. We are reaching you live on the network service of the NTA. Shortly, we'll bring you the highlights of the morning news and later newspaper review. Let's join Musa Abubakar for the morning news. Hello, Musa. How are you today?
I'm good. Hello, Henry. Good morning. And thank God it's Friday. Well, the long-standing clamor for state police in Nigeria has gained significant momentum, with the majority of state governments throwing their weight behind the establishment. This major development emerged from the National Economic Council meeting held at the State House. The proposal, which has been years in the making, seeks to devolve policing powers to the states, allowing for more localized and effective law enforcement, with many Nigerians eager for a solution to the country's persistent security challenges. The move towards state police is seen as a crucial step in the right direction.
Most of the states are in agreement with the establishment of state police in Nigeria. But today the council have decided to step down the discussion until the next council meeting, because we need to come up with a report from the secretariat.
President Bola Tinubu is set to present the 2025 budget proposal for a joint session of National Assembly next Tuesday. This announcement was made by President of the Senate, Godswill Akpabio, during plenary on Thursday. The presentation of the budget proposal is a critical step in the budgeting process, as it provides an opportunity for the President to outline the government's spending priorities and fiscal policies for the upcoming year.
His Excellency, the President of the Federal Republic of Nigeria, has indicated his intention to bring the 2025 budget proposals and estimates to a joint sitting of the National Assembly on 17th day of December 2024.
Now, the House of Representatives has taken a significant step towards addressing the environmental concerns in the Niger Delta region. The lawmakers have mandated the Committee on Environment to investigate the unprofessional disposal of seized crude oil and petroleum products from illegal refineries. This adoption of a motion on notice during Thursday's plenary session. The motion highlighted the devastating impact of the indiscriminate disposal of crude oil on the environment and the health of the people living in the affected areas.
Environment to halt environmental hostile practice for an eco-friendly and professional method of disposing crude oil and allied materials seized.
Now, in a move aimed at strengthening leadership and enhancing collaboration, the Nigeria Governors Forum has convened an emergency meeting to tackle the nation's most pressing issues as the country grapples with challenging economic times. The forum is working to build a vibrant process that guarantees a true reflection of democratic dividends. This critical gathering brings together state governors, policymakers, and stakeholders to forge a unified path forward. Nigeria is stepping up efforts to reduce maternal and newborn deaths by 30% before 2030. To achieve this goal, a special advisor to the President on Health, Dr. Selma Ibrahim Anas, is convening a high-level meeting with key community actors from 3 of the most affected states. This move is part of a broader strategy to tackle the country's high maternal mortality rate, which stands at 814 deaths per 100,000 births. The World Health Organization has identified improving quality of care as a priority to addressing preventable maternal and child mortality. Nigeria has made some progress in reducing maternal and newborn deaths, with a 30.4% decrease in maternal mortality rates between 2000 and 2015. However, more needs to be done to achieve the Sustainable Development Goal target of reducing maternal mortality to less than 70 deaths per 100,000 births by 2030.
That is a community.
The federal government has reiterated its unwavering dedication to achieving universal health coverage targets, driven by President Bola Tinubu's national health goals. Coordinating Minister of Health and Social Welfare, Professor Ali Pate, emphasized the government's commitment to improving health outcomes for citizens during a ministerial press briefing in Abuja.
The key issue is whether to revitalize, whether to enroll. Somebody has to pay the premium. We've raised some, but if we can raise more, if Nigeria can invest more in health, the healthcare system that we have will go even much further.
And those are the news highlights. Good morning, Nigeria continues after the break.
As this year draws to a close, we would like to express our sincere gratitude for your continued support. From breaking news to heartwarming stories, we are committed to bringing you credible content and delivering captivating programs that keep you glued to your As this year draws to a close, we would like to express our sincere gratitude for your continued support. From breaking news to heartwarming stories, we are committed to bringing you credible content and delivering captivating programs that keep you glued to your screens. Our team is committed to providing exceptional service to delight our clients. We say thank you to those who have supported us through the year, from government agencies to corporate clients, political parties, religious bodies, and, most importantly, our viewers. As we welcome the new year, we look ahead with a promise to bring you the best in broadcasting as we continue this journey with you. Season's greetings from all of us at NTA.
The world needs mums. With a splash of golden terra oil, a mum can transform a frown into a smile. Change no thanks into yes please. Resolve family feuds without blowing a whistle. Providing tasty family meals is all that matters. Where there are moms, there is love. Golden Terra Oil, for pure love.
At break time, when my champ needs to keep going, he's going to need his favorite snack, containing calcium, iron, and fiber.
Milo Energy Snacks, snack of future champions.
Milo! No buy am! But why? No see say this big bull bag of rice no get the new big bull holographic seal. Not true!
Introducing the Big Bull Holographic Seal Tape, your favorite authentic Big Bull rice, 50 kg and 25 kg. Now with holographic seal tape. This is to ensure you get the premium product from Big Bull Rice. Do not buy if the holographic seal tape is not on the bag or is broken. Big Bull Rice. Tasty rice nourished you.
Our food, our health, our tomato paste. There is no tomato paste, the taste of Nigeria. There is no tomato paste, carry. Richico tomato pesto, Tiwani. 100% natural tomato. Namunde, alelelelelele, oh, alelele, oh, ale. There is no tomato paste, the taste of Nigeria.
The counsel of our fathers.
I will urge and advise our younger generation to use talent and brain to sort out problems, not arms.
Nigerian youths, let's build our nation together.
You have to move from the point where you protect and defend your religion to a point where you also recognize the rights of the other person, of the other religion, and protect it. So if I am protecting my own territory and my own people and trying to emphasize their rights and protect their rights, I should also be thinking about how to protect the rights of the others.
Both Islam and Christianity recognize and defer to God, and both recognize the temporariness of the life of this world and that ultimately we all go back to God for the day of reckoning, when everybody will render an account of his life on this temporary abode.
From the Atlantic across the savannah to the Sahara, we rise, a land of the free, we know they tire. We dream great, our spirit is undying.
Resilient, rooted like palm tree, we sway in colors, with undying demand. We make solutions, we ignite passion, yeah. Each ethnicity is unique, we are more than just a nation.
We are Nigeria, strengthening unity, we know they carry lives. We are Nigeria, together live the dream of a land with great destiny. We are Nigeria.
I am the real Nigerian. Brought to you by the National Orientation Agency, NOA.
Welcome to Newcastle.
This Saturday, Newcastle United.
Gordon, and the header is a beauty.
Leicester City.
A swing from Ayew. Oh, they've done it in the 98th minute of the game.
Newcastle United versus Leicester City. Live on Sporty TV.
Sportybet sponsors coverage of the English Premier League.
Thanks for staying with us. You're still on to Good Morning Nigeria on the network service of the NTA. Up next is Newspaper Review.
We have Chukwudi Okoli-Ugbaja with us this morning. Chukwudi, good to see you. Good morning.
Same here. How are you, Nyere?
Very well.
She's under the weather.
I can see that. She has clouded herself with a protective fabric.
Yeah.
How are you, the man who is above the weather?
Well, I'm just floating.
Oh, I wish I could be a gentleman like you for 5 minutes in a day.
And because we have Ademola on set and he's looking like a senator this morning, so
Senator Ademola.
That would be good after retirement. You may want to look at that.
I'm not a politician.
I'll mobilize people for you.
No, I don't. No.
Anyways,
I don't think you will make it there.
I will not.
I don't think so. We know ourselves.
You know yourself. Good. Politics, okay. Please. Don't just...
Well, talking about your namesake is Governor of the Year. That's Senator Ademola Jackson, Nuruddin Adeleke.
Yes, okay. If you say that, it's okay.
Yeah,
fine.
So that that's why I was
he can flow.
Trying to push you into politics.
No. We will support them.
Anyways, let's see what the papers have. We'll begin with the leadership this morning and elites with insecurity. It says we're ready for state police. That's according to the governors. The riders for the government states take final decision in January. NEC asks state governments to embrace presidential food security program. All of that on page 4 of the leadership. Below that, we have a picture story here of the police and all the recoveries from suspected one-chance criminals. Beside that, we have PVCs. And INEC plans computer-generated slips for future polls. So many questions about that. Page 28 has all the details. And you want to ask what's happening in Kano. Yes, major shake-up. And the headline here says, Kano Governor scraps Chief of Staff Office, drops SSG, reassigns commissioners. That's on page 7. Interesting read that would be. Below that, Katsina government disburses 744 million naira scholarships to students. That's also on page 7 of the leadership. Let's quickly move now to the New Telegraph. The New Telegraph leads with electoral reforms. INEC to accept computer slip for accreditation on election day. That's on page 3. The rider says with Beavers, exclusive use of voter cards as means of identification should be reviewed. Proposes early voting for poll workers. That's on page 3. Above that, Tinubu presents 47.9 trillion naira 2025 budget to National Assembly on Tuesday. All right. Beside that, Senate orders stoppage of properties demolition in FCT. Issues warrant of arrest against Julius Berger, MD. That's on pages 3 and 30. You want to find out what's happening in Abuja and if your property is safe. Below the picture story, Fagbemi to governors tamper with local government funds, face impeachment. Once public funds misuse, non-performance will earn local government chairman jail term. Says financial autonomy designed to empower local governments to function effectively. That's on page 2 of the New Telegraph. Next, we have governors back state police as NEC takes final decision January. And finally, in a green strip at the bottom of the front page of the New Telegraph this morning, we have parents smoking could raise risk for MS in kids. Parents smoking could raise risk for MS in kids. That's according to a study, and that's on page 28. So you want to save your kids. All right, let's see what the blueprint has, Ademola.
Yeah, the Blueprint newspaper, just above the nameplate. Wike donates 50 vehicles, vows revocation over Abuja ground rents. Details on page 6. And just below that, we have Tinubu to present 2025 budget before NAS on Tuesday. And WAFCON 2026, Super Falcons to face Benin, Sierra Leone in second round. Then the major headline reads, Autonomy, loot LG Treasury, go to jail. AGF tells council bosses. Well, I hope they will heed that call. Then insecurity, governors endorse creation of state police, NEC to adopt report in January. Then reforms, that's electoral reforms, with beavers, PVCs no longer sole requirement for voting. INEC molds computer slips option to reduce hurdles and vote buying. ACF inaugurate tax reforms bills. Committee harps on dialogue. And Pencom assets growth to hit 22 trillion DG. Nigeria's crude oil production rises to 1.7 million barrels per day. Wow. You know, yesterday it was 1.6. Today, 6.9. Today is 1.7. We're making progress, Chooks.
Quietly but steadily. I like it. You know, you're going to find out that in 3 years' time, you would see that Nigeria has quietly handled so many things that people plank their argument on in terms of asking for, change in the country, restructuring, blah, blah, blah. Things are happening quietly. Well, this is in oil production. It doesn't exactly touch an issue like state police, for instance. But things are happening quietly. And there's something I noticed about President Bola Ahmed Tinubu. He gets his things done without delivering a punch. Real diplomatic leadership. There's a way he does it. I don't know what he
the buy-in of everyone.
Exactly. There's a way he does it. You see the state police thing?
Yeah.
More than 8 months ago, I started telling you here, state police is a matter of time. The people who are conservatively kicking against it are going to find out at the end of the day that if we have to nip, it's not in the bud, it's become a festering sore, insecurity in our country. We have to change the way we think about certain things. At the risk of sounding like a broken record, I want to repeat again that it was a military president that gave us private broadcasting. People would stroll into the studio and announce coups everywhere, as if that is how easy it is to make a coup. If you stroll into a studio and announce a coup, and the army are not backing you up, is that not stupidity in jeopardy? You know,
so ridiculous.
Things are going to keep on happening quietly. States can generate their electricity now and all that. The Bawanda is happening. Barton Naji and his team. You know, I like it when we look positively on this country. Things are happening. They may not be happening at the speed we want them to happen, but quietly, we are winning gradually. The green, white, green would always triumph.
I think this state
if we
police
believe
is really
in ourselves
a good
and God.
development. The state police is really a good development.
No, Demola is a matter of time.
It's a matter of time.
It's a matter of time.
It's a matter of time.
Because it's going to enhance the promptness, you know, with which to tackle crisis and all that. Having to report all the way to Abuja, you go, Abuja could now do some investigation. Oh, no. It's not. It centralized a few things. But of course, there are certain aspects of security, handling the nation's welfare, that will still be reserved for federal police. In the US, you talk about FBI. When the FBI strolls in, state police vanish. That is how their constitution is. And we're going to have something like that, you know. You read something about a computer slip being planned to be accepted.
Yeah, that's for the election.
Well,
that's electoral reforms.
Is that the right way to go?
You just key in a code in it. It takes you to the computer that tells you that this person is qualified.
Yeah.
You're saving cost.
Yeah.
We are very conservative people. Old habits die hard in Nigeria. There are so many things we do for the symbolism of it, for the traditionality or traditionalism of it. I sure I don't speak bad Igbo somewhere. We need to do away with things that are just done for the heck of it.
But what's the guarantee that you have computers that are functional in all our polling units on election day?
No.
How do you then verify? Because what's the guarantee that, okay, would these generated slips have, you know, security features such that it cannot be manipulated? Like I can't walk into a computer center and print out one slip and claim that I'm supposed to vote in a particular polling unit. Now, every other thing needs to work. The beavers needs to work. There has to be a way where the polling unit officers or whoever is conducting the election can verify that you're actually registered in that polling unit. I mean, that way, that's how you're going to be able to prevent...
Let's not bump time a bit. Everything you're saying needs to work. It's required by the voter card. Would also be required by the computer slip. So that's a different thing. It's the cost saving that I'm concentrating on. Everything that you need to key in from the voter card would also be needed to be keyed in the computer slip.
My point is
all inclusive. That everyone is included in the voting system.
My point is with the PVCs, that cannot be cloned. You can't get a copy of the PVC just anywhere. There's no way you're going to manufacture that. But I'm talking about this.
You're talking about
these
physical
paper slips.
PVC. It's the code on it that matters.
That's what I'm saying. Do they verify when you go to vote?
Yeah.
Do they verify the code on your PVCs?
It has to take you to. It's not just the PVC you present now and you vote. You present the PVC, they key it into a system to show that actually it's real.
Do they do that in all cases? That's what I'm saying.
Well,
that's when people go to vote with just your PVC, just citing it and all.
Yeah.
They just do the PVC, the beavers still and all that. But the beavers also are credit because, I mean, it has, you know, the record. But in cases where it doesn't work, say in a general election.
Yes.
Say in a general election where we have issues, maybe in some, you know, polling units, the beavers is not working efficiently and then they're asked that, oh, let's just follow the register or something. I mean, people could just walk in with any slip from anywhere. That's my point.
They can walk in, but that slip would not work if preparation has already put data on a system. That's the point I'm making.
It has to be generated.
It has to be generated. It has to.
It has
you
to be
key
generated.
it into a system. The system brings up something that tells us that you're not a ghost.
It has
you
to be generated.
You know? But it's the cost effectiveness that I'm actually concentrating on. We're wasting money on so many things. Why, for instance, can't we have a central data system the police can take to do their work? The NIN people, or NIMC, can take to do their work. Everyone wants to replicate for reasons that are best known to them. That's the point I'm making here, you know, is the cost effectiveness I'm concentrating on. The other things can be handled later.
Okay,
right.
your point is well noted.
Talking about other things being handled, what's happening in Kano? Do you have an idea?
The idea again is that maybe a governor has decided that the office of a chief of staff is superfluous, and that is a political appointment that is neither here nor there. I hear that some chiefs.
Okay, all right. We have to cut you now.
I shall say then send you.
Just hang.
I like that gist. You hear that word. I want to hear that. You hear that.
We must never go unprofessional. No. It's time to go.
We just have to cut you now because of time. All right, thank you, Chooks.
He was about spilling one juice.
No, he can spill it.
She wants me to walk from here to Kuje prisons.
We'll take a break now. Good Morning Nigeria continues after. Stay with us.
Nigeria, ready to breathe cleaner air and save money? Let's talk about gas. Drive with CNG, the smart, cost-effective choice. Fill up for less and travel further. Save money, save the planet. Switch to LPG for cooking. It's cleaner, healthier, and better for environment. Say goodbye to smoke and eye problems. Do you know Nigeria is a gas nation ranked 9th globally with over 209 trillion cubic feet of gas reserve? Gas isn't just for cooking and driving. It powers industries too. Cleaner, cheaper, and more efficient. And the best part, conversion centers are popping up everywhere. It's never been easier to switch to gas. Join the cleaner energy revolution. Choose LPG for cooking and CNG for your vehicles. Clean energy for brighter future. This message is brought to you by the Office of the Honorable Minister of State for Petroleum Resources, Gas, supported by the Nigeria Midstream and Downstream Petroleum Regulatory Authority, NMDPRA.
The counsel of our fathers.
My advice to these young people is please do not take us back to those harrowing days. You probably do not know what it is.
Nigerian youths, let's build our nation together.
The federal government of Nigeria warns vandals of national assets, electricity transmission towers, cables, and other facilities to desist from this act of sabotage. Vandalism is a serious crime punishable under the law. Vandalizing electrical equipment will affect millions of Nigerians, including your loved ones. Remember that national assets belong to all of us, hence the need to protect them. Report all cases of suspicious movement around electrical facilities to security agencies. When you see something, say something. This message is from the Federal Ministry of Information and National Orientation in collaboration with the National Counter-Terrorism Center, NCTC, Office of the National Security Advisor.
This Saturday, FC St. Pauli. Werder Bremen. Watch live FC St. Pauli versus Werder Bremen on Sporty TV.
Sporty Bet sponsors coverage of the German Bundesliga.
I think Amaka should just move out of the house. Yes.
No. Standing out of the house is not the right thing to do.
Oh, there you go again with your sentimental family stuff.
Baby, if our aim is to stop this affair, it is best achieved under our roof.
You do something terrible, and you'll be acting innocent.
What are you going on about?
Don't ask me that question again. You couldn't even control yourself in the presence of our visitors.
What are you accusing me of, woman?
My son, I don't know how serious you are with my daughter, but there's something that needs to be done urgently before you move any further.
Anything, just anything, just say it. I'm ready to do anything.
There is a spell that needs to be removed.
A spell?
Family forever, the story of our lives. This Saturday, live on Sporty TV, Juventus.
Venezia. Juventus versus Venezia. Live on Sporty TV.
SportyBet sponsors coverage of the Italian Serie A.
Thank you for staying with us. You're still on to Good Morning Nigeria on the network service of the NTA. Just before we bring in our guests for our conversation this morning on assessing quality health care services, let's take this background report by Ibrahim Dan Hamidu.
Nigeria's healthcare system faces significant challenges in providing quality health coverage to its citizens. Despite efforts to strengthen the system, many Nigerians struggle to access basic healthcare services. According to the World Health Organization, Nigeria's healthcare system ranks 187th out of 190 countries in terms of healthcare access and quality. The country's doctor-to-patient ratio is 1 doctor to 4,500 patients, far below the World Health Organization's recommended ratio of 1 doctor to 1,000 patients. So, what are the barriers to accessing healthcare in Nigeria? Geographical constraints, lack of infrastructure, and financial limitations are just a few. Many Nigerians rely on out-of-pocket expenses to access healthcare, which can lead to financial hardship. To improve access to quality healthcare, experts advocate for a multifaceted approach. This includes investing in healthcare infrastructure, increasing the number of trained healthcare professionals, and implementing a functional health insurance scheme. In fact, the National Health Act recommends the elimination of financial hardship at healthcare provider points through the operation of the National Health Insurance Fund. This fund provides a basic minimum package of health services for all Nigerians. Experts also emphasize the importance of strong actions against corruption in the health sector. This can be achieved through a combination of top-down and bottom-up approaches, including community-led initiatives and collaboration with anti-corruption agencies. Experts on the program will discuss the challenges, barriers, and innovative recommendations to improving access to quality healthcare in Nigeria. Don't go away. It's about your health on Good Morning Nigeria.
Absolutely, Ibrahim Dan Hamidu. Many thanks for that background report. It's about our health this morning, and that's why you should stay glued to the NTA. We have joining us now for the conversation to discuss access to quality health care in Nigeria. Dr. Camille Shoretire, Director, Health Planning, Research and Statistics Department, Federal Ministry of Health. Many thanks for joining us, Doctor.
Good morning.
All right, also here with us and the regular, of course, we do sincerely appreciate Dr. Chris Otabo, a consultant orthopedic surgeon and CEO, Alliance Hospital, Abuja. Many thanks for joining us, sir.
Thank you. Good morning, viewers.
All right. We also have in the studio Professor Martins Emije, DG CEO, Nigerian National Medicine Development Agency. Professor Emije, you're welcome to Good Morning Nigeria.
Thank you. It's nice to be here again. Natural medicine.
Natural medicine.
Nigerian Natural Medicine Development Agency. NNMDA.
Oh, yes. Great. Thank you so much for that correction. Nigerian Natural Medicine Development Agency. Also, via Zoom from Lagos is Dr. Olumuyiwa Olusanya. He's the CEO in Signal Health and General Secretary of Health Management Care Association of Nigeria. Dr. Olusanya, good morning. Welcome to Good Morning Nigeria.
Good morning. Thank you for having me.
Thank you. Okay, let's just start with, yesterday was the Universal Health Coverage Day, which is celebrated annually and globally. And the campaign is to advocate universal access to essential healthcare services worldwide. And the key messages, I think there's three key messages: health for all, leave no one behind, and invest in health. Where are we in Nigeria? Where is our stand on this? Let me start with the Director of Health, Dr. Camille Shoretire, Director Health Planning Research and Statistics Department. Tell us.
Good morning, Nigeria. Happy UHC Day.
Yeah.
We marked the day yesterday.
Yes.
And I will tell you we are on the right track at this time on our journey towards universal health coverage. What we did yesterday was a reflection of where we are. We had a press conference by the coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, where he gave an overview of where we are. I must quickly remind us that about a year ago, all the 36 state governors and FCT administration and our partners signed a compact with President Bola Ahmed Tinubu on service agreement to improve the health system. And so far, within the last 1 year, just like the minister mentioned yesterday during the press briefing, we have been able to enroll over 2 million Nigerian lives into the health insurance space. This is not attributable only to the federal government effort, but the state governments have also contributed. And of course, the private sector supporting this. We currently, we are revitalizing hundreds of primary healthcare centers. Some are being funded through the National Primary Healthcare Agencies. The 36 states of the country are currently revitalizing over 200 of those primary healthcare to improve access to, especially to our pregnant women who will have access to antenatal care, safe delivery, and care for the newborn to reduce morbidity and mortality. Also, in terms of, we also anticipate that a project that is coming up next year, the Hope Health Project, will be, as part of its plan, will be revitalizing additional 2,000 primary healthcare centers. The Basic Healthcare Provision Fund facilities are there that are currently supporting 1 PHC per ward across the nation, providing services, essential package that we need to improve the health of our people. Back to the question, government is currently on an ambitious plan to improve the health system through the Nigerian Health Sector Renewal Investment Initiative, which is using the sector-wide approach. Here, we're having one conversation with all the states and our partners. We have a plan. All our plans are aligned into one. We understand ourselves, and also resources that are needed to prosecute this plan are also aligned. So we speak, when we talk about sector-wide approach, we talk about one plan, one budget, one report, and one conversation. On UHC, we're on the right track because more than ever before, within a year, we added over 2 million lives on enrollment. And it's estimated that if we had done this over the last 20 years, 40 million Nigerians, as of today, would have been insured. And then the financial hardship we are trying to prevent would have actually been significantly reduced, if not eliminated at this time. We are on track.
We are on track. Okay. Okay.
Dr. Shoretire, you say you're on track. I do not know if Dr. Chris and the other doctors here, as well as Dr. Olusoya, would agree with that statement if you're on track, because I mean the maternal and child mortality rate is still high in the country. You said 2 million Nigerians have been registered in the National Health Insurance Scheme. What's the quality being served on that platform? How many people who are enrolled can actually access health care, and then, the deliverables, that are supposed to be in that package. There are so many issues at the moment, so many health facilities are understaffed. So when you say you're on track, I mean, I would like Professor Martin Semije, to tell us if you agree that we're actually on track. And, I've mentioned a few factors or a few challenges that we're currently facing in the health sector, and what your thoughts are at this time.
Thank you very much. I would rather not rapporteur what my colleague had presented, but to present my opinion on this issue, and then you decipher whether I agree or I do not agree. And in this respect, I would like to say this, that as far back as 1978, heads of governments recognized what we should do so that there will be universal health coverage. Reviewed properly in 2018, heads of governments of Africa saw the lacuna. They saw what was missing. They saw that most of the people in their countries, our own continent, assess health through traditional medicine. It's not theory, it's practical. We like pontificating a lot. When you go practical, it is there, all of us see it. So it's our heads of governments or of African countries, after they have talked with all of us on the field, and they know, because they also have brothers and sisters and parents, they have children, so they know all of this trouble. They know where the problem is. And they say, look, for us to achieve universal health coverage, key component of it is traditional medicine. Look at the 3 points that UHC mentioned. Access to all, for all. Yes. Leave no one behind. Yes. Investment. Yes. So, we already have marking scheme. Is there access to all? Are we leaving no one behind? Are we having proper investment? Answer it yourself, I will not answer it. But I can tell you, as a government functionary, that to the extent that government is putting in place things, facilities, infrastructure, and strategies towards achieving these key objectives, then we are in a process. For us, those of us who are key players in healthcare delivery system, from the angle of innovation, science, and technology, which is what drives the world. Health is science, but it's not science is not health.
Health is wealth.
Yes, health is, if you don't have robust and solid science and technology, you are a joker. You won't go anywhere. So, unless we invest well in science and technology and the innovative approaches to getting health to our people, we will just be doing copying and pasting based on our colonial curriculum, which is what I'm a pharmacist, a Western trained pharmacist. Before I went into studies in natural medicine, so I can tell you on both sides what exactly they are. Right? So we need, therefore, to change strategy. Look at the strategy we have used over the years, decades. That will begin to change. We have to begin to change those strategies in order to achieve these three key areas that UHC wants to achieve. And that is investing seriously in natural medicine. If you go to our rural communities.
All right. Thank you very much, Professor Emije. All right, thank you. We must invest in health. And just like he said, government is already putting in several measures to ensure that we achieve this goal. Dr. Otabo, you are a practitioner. You are in the field. You've been there for many years. My question would be, from your own perspective, what do you think are the major barriers to accessing quality healthcare in Nigeria, and how can they be addressed?
Thank you very much for having me on your program this morning. The Universal Health Coverage Day was yesterday, and the topic is quite apt. And it says, government, it's on you. And there's no better way to put it. We cannot discuss the healthcare of our country outside of the context of our present socio-economic realities. You can't talk about healthcare cost and affordability and accessibility without talking about the cost of petroleum products. There's a nexus. And in the last 1 year or so, we are seeing many more people, millions, being pulled into poverty. And don't forget that these people would have to pay for their health care by themselves because there's no social protection and no insurance for health care. The director from the Federal Ministry of Health talked about 2 million people. I listened to the minister's speech yesterday, quite reassuring, though progress is being made, but painfully slow. And, you know, when you make progress on one hand and then the progress is taken away from the other hand, you don't, at the end of the day, there's probably a zero progression or a net negative. In 2012, I was a member of the committee that hosted the African Heads of State in Nigeria at the International Conference Center. It was Abuja plus 12 meeting. And it was to reinforce the meeting that was held 10 years before that time to talk about investment in healthcare. And in that meeting, it was agreed, and every head of state in Africa signed to that document, that 15% of the healthcare budget should be plowed into healthcare. Since that time, the highest we've gotten is 6%. Even the last budget, the current budget we are using now, is still less than 5%. So because if you don't invest in healthcare, you're not going to get the results. It's simple as that. So we have a lot of other things that have become priorities to us as a country. And healthcare is on the back burner. Until we address that, we're not going anywhere. Secondly, the National Health Act, which was signed into law by President Goodluck Jonathan in 2014, that document speaks to a lot of the problems that would have addressed universal health care coverage. But I can tell you that as we speak, not up to 30% of that law, piece of legislation has been operationalized. I don't blame this current government. It's been coming from a long time. Not up to 30%. That document is waiting to be dusted and brought into the fore. He talked about a basic health support fund. That is only relevant with respect to the government sector. But studies have shown that 70% of Nigerian patients access private hospitals for their healthcare need. There's no medical director of any private hospital that have heard anything about the basic healthcare support fund. Meanwhile, if someone is involved in an accident today, they will bring the person to, if he's around this place, they will bring the person to my hospital because he's close and is known. Question, who will pay for that person's immediate emergency care? I thought government should have contacted people like us and every private hospital to say, you know what, we've got your back. There's money for you. If you treat, we will pay. But that's not existing. Even government hospitals cannot even boast of that. So there's a lot that needs to be done. As we speak, only less than 10% of Nigerians are insured. With all the figures that we've been talking about, far less than 10% of about 240 million people. That means we are talking about less than 20 million people.
Even those that are insured, what do they enjoy?
Question, I was coming to that. Those that are insured, what is covered? The insurance system is so, just make sure that it's just malaria and gastroenteritis and headache. Because if it goes beyond that into real medical, crisis, you're on your own. So we can't really be talking about universal health care coverage. Let's sit down and have a robust discussion with the governors, the commissioners of health, the minister of health, coming together and say, look, where do we put our finger on this? And it starts from investment. And that investment, we must look at the budget. I think I will stop here for now.
All right, many thanks, Dr. Otabo. I'd like to get to Dr. Oshiretire now. I'd like him to respond to some of the comments that have been made. Talking about the budget, at the moment, I think 2024, just about 1.48 trillion, about. We're looking forward to what 2025 will look like. The president will be presenting that next week. But in terms of budgetary allocation, would you say that we're on the right track?
Thank you very much. I've listened attentively to what colleagues here have mentioned. For the current administration, we wouldn't want to dwell on what has happened in the past, but we're coming from somewhere. And I can tell you that even for the federal tertiary health institutions, they are having a better deal now. We have funded more cancer centers in different geopolitical zones. We are refurbishing and rehabilitating many service delivery units in many of those big hospitals. I would like to quickly say that general hospitals and PACs belong to subnationals. So what we do at the federal level with our National Health Insurance Authority is to give appropriate guidance to states, and now with the enthusiasm being displayed by Algon, to support them to make sure that the facilities are at that level. Last year, we had a deliberate funding of the health sector, a departure from what has happened. Because with the Nigerian Health Sector Renewal Investment Initiative that is being implemented by the current administration, we did a diagnostics at the beginning of the administration. And we called major stakeholders to really know where are the pain points in the health system, which one can we easily address. It's a long journey, but we have started right. Because increased funding, deliberate funding, even with the establishment of more federal medical centers, conversion of teaching hospitals in several states to improve access is currently ongoing. The budget may not be enough, but now the way we utilize it is now more efficient, more effective, and focused. Because in the Health Sector Renewal Investment Initiative that we are implementing currently has a strategic blueprint with the contribution of all the 36 states of the Federation. We decided together this is the direction that needs to be, that we need to follow, and we are gradually following it. The subnationals have their own priorities and challenges as well, because we also expect secondary care facilities, the general hospitals, to be improved. One of the interventions we have to do to make sure that our money is invested properly is doubling the production of healthcare professionals. We all know what Japa syndrome has done to the country, and now there has been a deliberate effort by the current administration. Ministry of Health, working with Ministry of Education, has made a deliberate decision that university intake for medical students, pharmacy students, nursing, midwifery students, and other health professionals should be doubled. So that, and this will go, yes, this will go with expansion of infrastructure and facilities in preparation for this increase in number, and then how to retain them. We are working on the migration policy for our health workers to ensure that our brain drain is converted to brain gain. And in the next couple of weeks and months, we'll be seeing Nigeria signing MOU with countries, major destinations of our health professionals, to see how whatever they've acquired, their experience and skills, can be deployed back home. On budgeting, what we know now is a significant departure from what we used to know. For the private sector, we are collaborating with them through the National Health Insurance Scheme. They redesign packages to make it more affordable and to address beyond malaria and other things that he mentioned, so that whatever you need in a household, this financial protection is dear to the heart of the current president of the nation. That a household of 2-3 children, when 2 or 1 of the children has malaria and has to be admitted, then the household income becomes depleted. This is the financial hardship, our aggressive campaign to make more enrollment of people into the health insurance. And government is taking more responsibility. Like we just recently launched a maternal mortality reduction innovation initiative, MAMI, which has provided that any woman who is about to deliver and needs a cesarean section and is unable to afford it can be given that service free of charge. Government takes up the responsibility of paying for that. And we have close over 700 women that have benefited so far, but we are still signing MOUs with different hospitals. Yes, if they are able to refer. How many health
facilities are able to carry out cesarean sections?
Thank you very much. Part of the plan, like I mentioned, that we are in the process of implementing a particular project called Hope Health, is that we know what is happening in the rural areas. If the primary health care centers in the rural areas are able, they have the right staff with the right skills, they identify women and other people, men, children, that need secondary services. Effective referral linkages are being established. This is the task we have given National Primary Health Care Agency in collaboration with the state ministries of health to ensure that we smoothen this transfer. A woman comes to the primary health care to deliver, and they discover that, oh, she has twins, and one of the first baby is coming with the leg. That will need a cesarean section. They can easily evacuate, and that's why we launched the National Ambulance Emergency Medical Service and Ambulance System, NEMSAS. I'm sure they are working with Alliance Hospital, but the reach has not expanded to the level we wish. But they are currently running, and they have a code, 112, that you can call if you see an accident victim anywhere. Ambulances, one of the ambulances in the nearby hospitals that have subscribed, we move the accidented victim to the nearest hospital, where this NEMSA scheme, we pay for the first 48 hours.
Okay,
treatment.
Dr. Shirotire,
So
thank you so much. There are 2 more questions that I would like to ask you, but I want to, because it has to do with the Basic Health Support Fund that the doctor talked about. And also, you said you had a meeting with stakeholders and they highlighted the challenges, which you did not tell us. But when I come back to you, but we need to go to our Zoom guest in Lagos, Dr. Olusoya. Dr. Olusoya, we want to have your own perspective. Let's have your perspective on the challenges, in assessing quality healthcare in Nigeria, and especially the role of the health insurance, the role the health insurance play, in all these, in increasing access to quality. Since you are the General Secretary of the Health Management Care Association of Nigeria. Tell us.
Okay, good morning, everyone. It's a pleasure to be on the program. So the story of our road to universal health coverage is a long journey. It's a journey. It's not a sprint, it's a marathon. And I'd like to, if possible, just show something, to just speak to that. If you don't mind, there's a diagram I'd like to show. Can I go ahead? Can you hear me?
Yes, go ahead. We can hear you.
Okay, so you'll see. Okay, so the challenge of Nigeria is very, very simple. In 1960, Nigeria's population was 45 million. Meanwhile, the source of this data is from the World Bank. Nigeria's population in 1960 was 45 million. In 2023, Nigeria's population is about between 218 and 223 million. and that's population growth of about 300%. Average GDP in 1960 was about $200. Today is about $2,100. Healthcare expenditure at 2016 1.2% is currently 4%, and we're actually below the required 15% if you want to go on par with most of the developed countries. Now we're having a constant population growth, continuous population growth of 2.5% every year, which means that our population growth is exceeding our economic growth year on year. And this brings us to the issue of economics. I just wanted to show this so that we can have a good perspective of what has happened over time, why we are lagging behind, and what are the things we need to do to address it. If I compare this with the US, which will be our model, we're looking at how they've managed our health. You see that they had a population of about 180 million in 1960 to about 332 million in 2023, just a growth of 75%, where our own has been over 300% and continues to grow. This is where I want us to look at. We have a US that the current annual population growth is 1.5% compared to that of Nigeria. What it means is that they have more than enough wealth to share amongst their population. So I just wanted to share this to put things in perspective, that our population growth over the years has outstripped our economic growth. We need to face this reality because that's the truth. But what can we do to make sure that we fasten that road to universal health coverage? Using health insurance as a major tool, as a major model to provide access to all Nigerians. So on behalf of the HMOs, the strategy we think that should be applied is, number one, for the government to prioritize healthcare. Because the truth about it is that until we prioritize healthcare, productivity will continue to lag behind. And that's why I share that example. Look at economic growth, look at population growth. Population growth is outstripping economic growth. And the major thing that should assist that productivity, which is access to healthcare, is lagging behind, which will further drag productivity down. So having health insurance, because the model is already on ground, thanks to the federal government's program and policy on the National Health Insurance Scheme, which has enjoyed a lot of solidarity and goodwill since inception, since 2002. It has enjoyed a lot of solidarity. So what we are proposing is that this program should be scaled up nationwide, and there should be uniformity. Because if you want to, the first leg of the universal health coverage, when you talk about coverage, you want to address access. You want to make sure that you have access first. I know that we can't have the best of the quality at the moment based on our economic growth level. That's the truth. But how can we provide value at the amount that we can afford? That's the first thing. So providing access, that's one of the things that health insurers are doing to work with government, partner with the Ministry of Health and the NHI, National Health Insurance Authority, to scale up access through social health insurance schemes and private health insurance schemes. But having said that, social health insurance scheme is the best model to provide massive coverage for health insurance. And what we have advocating, and we said at the meeting with the DG of NHI last month, what we are advocating is that the social health insurance scheme should be uniform. What we're saying is that if you want to achieve access and make sure that the access is 100% as much as possible, if you start to fragment the pool and you have different types of health insurance schemes, social health insurance schemes across the country, you will have challenges in actually covering them because you have a lot of fragmented pools and you have different schemes by different states. So while the states have started their scheme, which is commendable, the BACF, the fund, is being given to the states to assist them with their social health insurance. This is a good initiative. can we get them? Can we get some form of compromise so that everybody comes under that national program of the NHIA, which is the NHIS, so that we have just one scheme, one social scheme that will be administered by each of the states of the 36 states, so that we have one pool, one pool. Once we have one pool, enough fund comes, the plan is across the country, and access will improve with that kind of system. It's better that way. You will have private health insurance as supplementary and complementary by the side. That's not a problem. But if you have one social health insurance pool, and all the states can agree to administer those benefits of that plan in each of the states, then you have one massive pool. There will be massive cross-subsidization, making sure that that cost is really affordable and can do more. Right now, all those schemes are fragmented. Different states having their own schemes, and those schemes do not connect. For example, if I buy a scheme from Ogun State, a social health insurance scheme from Ogun State, if I come to Abuja, I can't use it in Abuja. So if a pregnant woman comes to Abuja and she has to deliver in Abuja, and she bought a social scheme from one of the states, she can't use it in Abuja. So if we have just one scheme, it will further reduce the need for government to now be paying, like what Dr. Shoitire is saying, to set up additional funds for them to be paying for pregnant women, what they are trying to do now. If we had just one scheme that is accessible nationwide, one policy, and all the states are administering it and managing their funds, and they are reporting to the NHIA, and they are sharing from the BSCF, that's fine. We have one massive pool that will help to cross-subsidize properly. If you understand the principle of insurance, cross-subsidization is one of the game changers. If you have a massive pool of people, you find out that it will be cheaper to provide care for them. That's one thing. So if you can achieve access through bringing everybody together through the social scheme, so that more Nigerians, the masses, can come under it, it will further reduce the cost and help to improve access greatly. So we will have achieved one of the major three pegs, which is the access. Then we can now talk about affordability. We can now talk about quality. We can continue to improve quality. Quality is a never-ending journey. You continue to improve it through policies, through guidelines, for example, treatment guidelines, for example, for primary care, for secondary care, and making sure that it is enforced at the primary care level and secondary and tertiary care level like that. So as an association, we are working to make sure that we deploy on social health insurance scheme, because most of HMOs, a lot of HMOs are partnering with the government to make sure that we deploy social health insurance schemes across the country. But these are issues that we feel that we need to address to move forward. It's better to have access. You have a scheme that is basic. It doesn't have to do everything. For example, we have challenge with infant mortality, maternal mortality. If we use this access strategy to address these two major areas, so that Nigeria gets off that list, where we are becoming the worst in maternal mortality in the world. This is bad for the last 30 years. Both infant mortality.
Dr. Olosaya, thank you very much. I would like to stay with you, and I hope your connection remains good. Okay, it looks like the connection is bad, but listening to Dr. Olosaya, Sonia talk about population being a challenge, and I'm wondering if we should be targeting policies that would reduce population, and then him talking about centralizing the NHIA such that states shouldn't have theirs. But we're talking about state police now. We're trying to decentralize things. So that states can handle their stuff and all of that. So NHIA, has it been effective so far? And then why would he be calling for all the states keying into NHIA and not going into all of that? But Professor Martin Semeje, when you spoke earlier, you talked about natural medicine as the way out, and I know that people like Dr. Chris Otabo may not want to agree with some of the points you want to make in that regard, but tell us, how does natural medicine help us out of this challenge that we face in our health sector?
Okay, thank you. And I mean, we are intellectuals. We don't have to agree. The facts speaks for themselves. And if you look at the way most of us, the elites, behave in this country, we are fast to draw examples from a country like the United States of America. You can see even the folk from HMO talked about United States of America.
The statistics.
Yes,
Statistics.
yet in his suggestion, he said there should be one scheme for the entire country. Is it one scheme in US? If the package in Ohio, is that the package when you move out of Ohio to another state? The answer is no. So, and I'm trying to avoid a rapporteuring on a presentation, really.
The scenario there is different from what we have here.
Definitely. The scenario is different, and that is why we should think indigenous.
No, that's why probably he's suggesting that we adopt one scheme for all so that it will be accessible. That wherever you are, that even if you have that scheme in Abuja,
yes,
or you have it in maybe your state,
yes,
and you come to Abuja,
yes,
it will still be applicable. You can still access.
You see, because
health.
that pays the businessman more. It pays the businessman more than if Kogi State has its own scheme and Lagos State has its own scheme. Lagos is more buoyant than Kogi, so the pay will be different in Lagos and Kogi. But if you make it uniform, it means so that's why I said I don't want to go to that area. You see, when you see a government functionary talking about something, he's talking from the point of social service.
Okay.
The truth is, the people from the private sector, they are not Father Christmas. They are doing business. So you don't expect them to also come and be telling you that this is the best without thinking of what they are going to make from the business. That's the truth. Now, take Asia. Yes.
Tell us about natural
Oh,
medicine.
yes, that's right. Because that's... Now, take Asia. Let's not reinvent the wheel. There are models that have worked in countries. Why are we talking of population? 218 million people. The entire Africa is 1.2 billion people. India alone is almost 1.4 billion people. So India is more than Africa in population. China is 1.3 something billion people. China alone is more than Africa, the whole of the 54 countries in Africa. So what are we talking about population? Yet they have access to health there in India or China more than African countries. And their model is their natural medicine. Their model, that's their model. You see, and that's why I said, let's not go too far. This thing I'm talking about, right? If you went to school, the way we all went to school to study medicine, pharmacy, and all of it, you won't be talking like this, the way I'm talking, because this is not what we were taught from school. What we're taught from school is different from what is on ground. Those of us who were born in the village, and our villages still exist today, we know how people are assessing health there now. And all the things that we are putting in place today, they are more accessible. In fact, in our institution, we say that if it is not affordable, it's not accessible. And credit to Dr. Chidebe from our institution. You can't be talking of access when you can't afford. If you don't have a relative that is now, my mother in the village, if he's sick, I can bring her to town. What about mothers who don't have people like me in town? And there are more than me. How many DGs are from my state? How many powerful doctors in Abuja do we have from villages that have people like that in town that can bring their people to town? We have more people in the villages. Let us shift our strategy to developing this method of healthcare delivery that our people are used to. And I'm not talking of something alien. World Health Organization has said this very clearly. It's just that countries that decide to make this a priority are making better headway in their healthcare delivery. Last year, in 2023, the WHO went to inaugurate the global headquarters for traditional medicine in India. $250 million US dollar worth a center of global medicine. I was privileged to be there. So, and when COVID-19 came, even the country that the COVID-19 started, 85% of what they deployed into fighting COVID-19 medicine was traditional Chinese medicine. And, I mean, it's there. So what we need to do is, and this is not, it does not mean that one should stop. No. That's why I don't agree with all this make something uniform. And for me, let me tell you, this government that we are privileged to be serving, one wonderful thing that will happen in this healthcare delivery is the local government autonomy. Because local governments must start designing how to ensure healthcare delivery in our local government, in our rural villages. We know we have polling units. You know we have polling units for election in all. If in less than 1 kilometer, you will find maybe like two polling units. If we can have polling units like that, we can also have health centers that will develop, right? So part key to this for me, therefore, is allow all the sub-nationals to go ahead with developing their institutions, while national is providing the leadership the way the director has said. And key to this is education. For example, the National Board for Technical Education under the present Professor Bugaje received approval from this federal executive council for middle level manpower development in health. That's education part of it. Training and skill acquisition. We have been designated as an awarding body for national skills acquisition in this area, in the different areas of healthcare. So if we invest in educating these middle level manpower, traditional birth attendants, traditional bone setters, traditional healthcare delivery practitioners all over, which are currently doing it anyway, because whether we like it or not, they are even doing it. They are the ones that provide these services in our rural communities. Yeah. And that's where we have over 150 million people that cannot come to Abuja or Lagos or Port Harcourt, that don't have the means, that if you dash them 3,000 naira in the village to buy a artemisinin combination drug, which is a malaria drug made from herb, they will use it to eat food instead of buying, because our healthcare delivery system in our rural communities, and I'm not going to be dwelling in the elitist healthcare delivery system of Abuja and Lagos, because I grew up in the village. I was born in the village. I was not born in the hospital. So if you go to these villages, if you say you have malaria, everybody in that community, they will mention a particular family where malaria can be treated. If you say, if your leg breaks, they will mention a particular family where they do bone setting. Yeah. Nigeria has the best bone setting technology in the world. So what should we do? Invest in developing it. That's where innovation, science, and technology comes into it. And all of this can run. If I go to the airport and I want to enter aircraft A, I will choose to enter it, you will choose to enter aircraft B. Let nobody tell me that I must go to a particular place to get healthcare delivery. It's my choice. In fact, if I want to die, it's my choice.
Okay.
So we must provide all that is necessary as a people, as a government, as responsible people who have gone to school. Our job, therefore, is to use our knowledge to develop these different available and possible means of providing options for people, so that people will have choice of what they want to do. I hope we know, as we speak today, some people, when they are sick, they will never go to hospital. They'll go to religious institutions. There are some religious groups that would never take blood transfusion.
Yeah.
And there are good records of even medical doctors. I have a wonderful, and I wish I can call his name. If not, that you people don't allow these kind of things. If not, in this national hospital, a professor of medicine, when he came to give us the wonderful testimony that he had on the use of natural medicine, which is currently using, a professor of oncology, And he told me, he told us, it was in public at our function, that it was when he went to China and he would have died of malaria, but was given herbs. And that was what changed his perception.
Okay.
So, developing our own indigenous system of healthcare is a potent way to achieving universal health coverage.
Thank you.
That is the meat of my presentation.
Thank you, Professor Emije. You are so passionate, so passionate about this natural medicine. But
maybe because that's how I grew up.
Yes. Some of us grew up.
I went to school to go and study, and I have seen it.
Yes, some of us also grew up like that. I mean, taking our
But you
and
were
all
born
that.
in a hospital.
I don't know where I was born. I was told, I wouldn't know. It's only what my parents. Well, I think I know I was told I was born in Lagos, so I don't know whether in the hospital or Baba Ilewi or more and all that stuff. But I want Dr. Otabo to respond, but also I would want the Dr. Oshiretire to tell us what government actually is doing to incorporate. But let's hear from Dr. Otabo, because he has not spoken, so let's hear your own view. What's your view?
Okay, just a word on the professor's passion. I like his passion, and there's point in what he's saying.
Yeah.
But until we're able to produce and develop evidence-based solutions through the traditional medical angle, we will have to make do with what we have, and which is working. It is the management of it and the deployment that is the problem now.
Yeah.
We are not lacking Western medical system knowledge and practice. Coming back to the topic of the universal health coverage, which is government, it is on you. It's like I wish this is during election.
Okay.
And I want to encourage the elites and the electorates and the media to hold the feet of those who are campaigning for offices to the fire. They should hold them responsible, because these are people that will determine whether you will live or die, in a way. Because if you fall ill in the midst of so much hardship, even people have lost their jobs, and those who are working is as though they are not, because the money in their hands have lost so much value, such that they cannot. Knee replacement that we used to do for 1.5 million is now 4-point-something million. We have not done anything wrong. It's just the implants and the inputs that have increased. Yet, people who are supposed to be coming in for this, they are poorer. So how do they afford that kind of care? So that's where the government comes in by way of investment. So when people are campaigning for offices that I will do this, I will do this, ask them, what would you do about my health care? Because now, thank God for the thing, it says, government, it is on you.
Yeah.
So you don't just allow people come take office like that. If you do that, it's your business. But you must ask them, what are your plans for my health? They must be able to answer it. And gone are those days when people just come, do 4 years and walk away, and then they become richer and just continue with their lives. Now, they must be asked fundamental questions. What are your plans? And it must be well documented and achievable plans. This is very important, because it starts from leadership. If we get the leadership right, we will get the healthcare right. If we get the leadership right, they will bring in the structure that will bring about this change. We've been talking so much about the problems. We've been talking about the paucity of care and all that investment. How can you not invest in health? I was in Canada in 2012. I took ill. I went to the hospital, and consultation fee was $600. And just a little medication that I would have bought for 15,000 naira here, they charged me $400. By the time I was done, in one consultation, I spent $1,000.
But I'm surprised that you went for consultation as a doctor.
No, of course, I do. So I asked my host, I said, is everybody a millionaire here? How can I spend $1,000 in one consultation? He said, nobody pays for healthcare in Canada. That everybody, they saw me as a foreigner. Everybody is under insurance. And I went to check their healthcare budget for that year. In 2012, their healthcare budget was $18 billion. Total budget was $45 billion. But almost half of that was on healthcare. That's how serious the government takes healthcare. Out of $45 billion, $18 billion was dedicated to healthcare. You cannot compare that to 1.6 trillion. How much is that? Compared for 200 million people. Alberta, I'm talking of just Alberta, of 4 million people, their healthcare budget was $18 billion for 1 year. Then in Nigeria, of 220 million people, healthcare budget is less than $1 billion.
I agree, Dr. Otta, but we need to get the budgeting right. But again, we want to speak to the doctors, but maybe that will be after the break. Let's quickly take this break. When we come back, we'll get into the conversation. Stay with us.
When we think about the digital economy, you can see it as the marketplace for digital goods and services. And increasingly, it's becoming a force to reckon with and an incredible contributor to economic growth, because we've seen the growth in technology and digital platforms. Technology has it really permeated every aspect of life and business, the way we live, the way we work. And when we talk about the digital economy, we're really talking about leveraging technology and digital platforms in a powerful way to drive growth, to drive solutions to problems, to drive applications, and to provide services.
The digital economy is something that has the potential to help Nigeria leapfrog a lot of its development challenges, right? Because think about what the mobile phone did for Nigeria years ago. That is the potential we have for digital, because it has a way of reducing the barriers to innovation. It has a way of being able to transform service delivery, whether it's government's delivery of services or whether it's services in the health system, where people can use digital to actually be able to see their patients better. But it takes a lot to realize that potential of digital. The first thing is like every other thing, there's an infrastructure you have to build to be able to make sure that digital economy can thrive. Think of something like, capturing that happens in Nigeria, right? Where you capture, people's biometric when they go for a driver's license, when they go for passports, and each of those are separate things. Can we imagine a system where we're able to streamline that and actually have a platform that exchange biometric information that makes it easier for people to access passports, easier for people to register to vote. But today it's very tough, right? But those are basic infrastructure that needs to be invested in. A lot of it is through government and private sector collaborations to make it happen.
If we're looking to accelerate growth in the Nigerian space, we really need to look at enabling the digital economy. That includes providing digital infrastructure, connectivity, because that's the highway, like the highway that everything rides on. We need to think about digital capacity building in terms of the suppliers to the economy and also the consumers within the economy. So a robust digital literacy initiative. The good thing about technology is that, one, it helps you to transcend boundaries. Two, it creates a level playing field, really, because if you create a solution, a technology-based solution that is applicable in this environment, that same technology can be applicable, exported to other environments. And, technology platforms also help drive collaboration, right? When we're thinking about innovation, when we're thinking about business growth, collaboration is an important part of that. So when we think about the impacts with the rest of the world, we find that actually technology platforms are giving us an opportunity to engage more actively, to collaborate, to create partnerships, to even export our knowledge and services for people to engage with all the great things I'm talking about technology and digital platforms. They need access, internet access, broadband access. So we need to make sure that access is more available and affordable for the average user.
The most important thing is to think about where you want to go as a country and actually what type of policies are going to help get you there. There are examples of countries who've been able to transform using digital, for example. There are very clear things those countries did to be able to make it happen. So a lot of this, the pathway to be able to solve these problems are not mysterious, right? It takes courage of the policymakers to be able to understudy some of these things and bring in the policies that work to be able to help them.
You have to move from the point where you protect and defend your religion to a point where you also recognize the rights of the other person, of the other religion, and protect it. So if I am protecting my own territory and my own people and trying to emphasize their rights and protect their rights, I should also be thinking about how to protect the rights of the others.
Both Islam and Christianity recognize and defer to God, and both recognize the temporariness of the life of this world, and that ultimately we all go back to God for the day of reckoning, when everybody will render an account of his life on this temporary abode.
This Sunday, live on Sporty TV.
El centro de Alex Baena, remate y ahora sí, gol,
Villarreal versus Real Betis. Watch live on Sporty TV.
Brought to you by SportyBet. Play with champions.
All right, welcome back. It's still Good Morning Nigeria, live on the network service of the NTA. And the topic this morning is on access to quality health care. Our guests are still very much with us. Let's get to Dr. Shireti Reynal, Director, Health Planning Research and Statistics Department for the Ministry of Health. Before we went on that break, Dr. Otabor was talking about his experience in Canada and all of that. And then I'd like you to respond first to what Professor Martin Semije said about, what natural medicine can do and the improvement, it can bring in our health sector. What is the Federal Ministry of Health doing, to incorporate natural medicine? And then, I was going to ask Dr. Otabor, because you're also a doctor, what's the resistance on the part of medical doctors in the country, not wanting to make use of, local, or if you like, natural medicine, and over-reliance on Western medicine?
Thank you. Let me reassure Professor Emeji and others that are very enthusiastic about the development of natural medicine in the country. That one of the pillars of the Health Sector Renewal Investment Initiative is unlocking the value chain. There's a presidential initiative on value addition in the system headed by an experienced national coordinator. What they are doing, amongst others, is to ensure that pharmaceutical companies in Nigeria are supported to produce the essential medicine to make it cheaper, and those that are not readily available in the country, we get pharmaceutical companies or investors who will come into the country and partner with local investors to produce generic medicine that will equally, of equal quality, if not more than that, for the general common ailments that we have in the country that has to be treated. Part of the plan of the PVAC, the Presidential Initiative on Unlocking Value Chain in the health system, is a robust research and development. And this applies especially to researching into the active pharmaceutical ingredients of most of our natural herbs and products that are locally, and they are doing that. A team has gone to India, meet with the Indian team that are specialized in that area, and see how we can domesticate that. In addition, the Federal Ministry of Health has established a department of traditional, complementary and alternative medicine that is actually working with all these traditional medicine practitioners to see how we can collaborate, do more research into what they are using, and see how to help them to introduce. Some of these products are already in the market, certified by NAFDAC for safe consumption. It's just that the extent that Prof is saying is a journey, and we are already on that journey. It is a deliberate action by the current administration to ensure that products from natural herbs and natural medicine practitioners that are being used are well researched, we know the active ingredients, and we make use of it in country and sell it to our pharmaceutical companies that are here to incorporate into the essential medicine list that we have. So NAFDAC, NIPRID, and other research institutes under the federal government are doing that. On the issue of medical doctors not patriotic, I don't think that statement is entirely true. Some use of natural medicine.
I didn't make
resistance. No, not you.
Okay.
It's a question.
Okay.
It's a question. No, not you, Prof. That Professor Major has even answered it previously. And what he said is, we were trained through the orthodox medicine practice. And you need extra knowledge or to acquire knowledge in this area to be able to prescribe. This is it. We see the patients, they bring their complaints, we treat them, and then what they are not even used to, what you are not used to, you cannot prescribe it to them. So, but the kind of engagement we are having now, having had a full department in the Federal Ministry of Health, things will begin to change over time. Because now we have a department that can bring up research products from the natural medicine practitioners. We have the NAFDAC, we have the NIPRID that will quickly do what they need to do and make recommendations for all this to happen. Like they are benefiting maximally in China and India, so that we too, we tap into that value addition that natural medicine brings on board.
Are you creating awareness on this?
Yes.
How are you going about it?
Thank you very much. I think they do Traditional Medicine Day. And Professor Major knows that.
But away from awareness,
Wait.
Prof, you speak to that. But what about education? You talked about the medical doctors,
Yes.
prescribing what they know. It's what they are taught in school.
Yes.
So are we doing something about education so that we can educate our own about natural medicine, such that you can go to a particular hospital and all they do there is they dispense natural medicines?
Let me quickly drop this information. Actually. We have a Federal College of Complementary and Alternative Medicine. We call FedCam. Okay. It's currently being repositioned and is going to provide this training for anybody who is interested in this area to acquire more knowledge and know the myriads of opportunities and knowledge, evidence-based, that are available in this space. We are the current coordinating minister and the Minister of State for Health and Social Welfare have reconstituted the management of this college so that it will take off as soon as possible. So we'll be hearing more details on this Federal College of Complementary and Alternative Medicine. I will be working with institutes like that of Professor Major to bring forth all information that needs to go into the public space in terms of what they do, where they can access those medicine or products, and giving a monitoring and evaluation report, like what NAFDAC does in terms of pharmacovigilance or post-marketing surveillance. They will give us, and then we'll be able to improve and move on that trajectory.
Okay. Dr. Shoretere, thank you so much. I don't want us to leave out our Zoom guest, that is Dr. Olusanya. I know.
Before we move to another thing, especially on TICAM department, because TICAM is a member of the board of the Nigerian Natural Medicine Development Agency.
What?
About having a uniform
okay, you
health
want him to address it. Professor,
yes.
we'll come back to you. Okay. We know that you are burning to speak more on this natural medicine. But let's bring in Dr. Olusanya. Dr. Olusanya, we have been talking about the several measures in which we can access health. Especially for the common man, especially those in the communities, those in the hard to reach areas. And another way is probably the private sector, bringing in the private sector here to assist, because, government alone, like they say, cannot do it all. How do we encourage the private sector in this?
Okay, thank you very much. Like I said earlier, when you look at best way to deliver access in health insurance for a nation, I talked about the three principles: access, quality, and affordability. Now, when it comes to affordability, the truth is that social schemes are the most affordable way to deliver health insurance coverage anywhere in the world. That's the truth. And especially in Nigeria, where resources are a bit restrained, you have to be able to rationalize and make the best of the resources. So what has happened over the years is that the private sector actually bettered this health insurance industry itself. The private sector pioneered health insurance in Nigeria as far back as the 1990s. You can check that out. The pioneer HMOs were incorporated in the 1990s and set up health insurance schemes before even the regulatory body came. And after the regulatory body came on board, we have been working with the NHIA, formerly NHIS, to make sure that through social health insurance schemes and complementing private health insurance schemes, we can achieve coverage for the entire nation. And I'll still come back to that principle, the principle that for you to get access, for us to achieve 100% access in Nigeria, you have to address the issue of affordability. Without affordability, you can't achieve access. That's the first thing you have to understand. It's a basic principle of insurance, is evidence-based. What it means is that you have to create a large pool. And the best model, like I've said, is social health insurance, not private health insurance. So I think the prof got it wrong when I was speaking. Social health insurance is still the best model. And who runs social health insurance in Nigeria is the government. It's not HMOs that run social health insurance in Nigeria. So I'm speaking for the government here. And I've said it that Nigeria has a brilliant solution, which is already working. The NHIS is the best social health insurance plan in this country. It's a pioneer social health insurance plan, and it is the best. And it enjoys the highest solidarity across the entire ecosystem in Nigeria today. What it means is that providers, all stakeholders are willing to support that scheme 100%. I've seen it in the last 2 decades that I've been in this ecosystem. So what can we do? We need to scale up that program. And private sector has been assisting the government, the NHIA, to make sure that this program works in Nigeria. Go and check all the partners with the social health insurance scheme are HMOs. So that's the role of private sector. And private sector has helped to promote the use of technology. As I'm speaking to you now, the DG of NHIA, in partnership with the private sector, in partnership with INCAM, with the Association of HMOs, the DG, the NHIA is building a health platform, a digital health platform, that will help to digitalize all the operations of the NHIS scheme as we speak. And the major drivers in that committee are people from the private sectors. They are actually very, very sound in technology. And we have a strong representative there. So talking about partnership, we are working together to make sure that we're able to expand this scheme to entire Nigeria. But what I said when I was trying to talk about cross-subsidization is that when you have a scheme that is uniform across the country, regardless of who is running it, what it means is that all the states will still continue to run their insurance scheme, but they will adopt the benefit structure of the NHI. Once they do that, the scheme becomes one scheme across the country, and it provides massive cross-subsidization. massive, that will even further bring the cost down, not take it up. And it's not going to be the bet for the benefit of HMOs. It's going to be the benefit of Nigeria, because the fund for the NHIS scheme, the social scheme, is with the government. It's not with the HMO. The government actually warehouses the funds. You know, they just pay HMO for administering and providing some services. But the fund itself is with the government. So that brings down the cost so that majority of Nigerians can have access to that affordable scheme that will be used to address the maternal mortality Dr. Shoyachere is talking about, the infant mortality, and take us off that negative indices that we have been on for 30 years. And we can achieve this thing in 2 years if we actually adopt this policy and everybody works together. Just let me give you an example. Look at the pension scheme that has been introduced to Nigeria. Despite the fact that coverage is still about, maybe 10 or 15%, it has pulled a lot of funds together and has brought a lot of stability to that sector. So with the new act, the NHIS Act 2022, you find out that enforcing the mandatory nature of social health insurance, not private health insurance. So I'm here speaking for social health insurance. And harnessing the mandatory nature of that scheme will encourage access if we can all come together and work together. And we've looked at this because we've looked at multiplicity of schemes over the years, and we have seen that it's counterproductive to ensuring that we achieve that cross-subsidization and bring every Nigerian under that pool. So private health insurance will only be supplementary and complementary. What it means is that if you can afford it in addition to social health insurance scheme, then you buy it. So I'm not here to preach the US scheme. I'm here to preach what is unique that can work for Nigeria. So those are the ways that the private sector has been working, bringing technology and making sure that we work with the NHI. Thank you very much.
Olusoya, many thanks. I just hope that we can really upscale the NHIA and, it will be accessible and affordable to all. But let's get to Professor Mijina. You wanted to respond to the TCAM issue. Yes. What, the Nigeria Natural Medicine Development Agency is doing in that regard.
Yes, just to give the information and to say that the director spoke excellently well, because the traditional complementary and alternative medicine department of the Federal Ministry of Health is representing the Federal Ministry of Health in the board of the Nigerian Natural Medicine Development Agency. In fact, on 4th of September this year, the Ministry of Health, led by the then Minister of State for Health, Dr. Alausa, launched 2 major policy documents: Traditional Medicine Policy 2023, which is a review of the previous one, and the Maiden Essential Medicinal Plant List for Nigeria. So in terms of policy and propositions for interventions, which is what ministries do, that is not an issue. And that those policies are there is different from implementation. If you take that policy, the implementation of the policy, if we were implementing the traditional medicine policy, I won't be saying there's a need to support it, because there's already policy, and it's not new policy. It has just been reviewed last year, launched by this current government. So the policies are there, but the implementation requires investment in education and support for research for development. By the way, I worked for 20 years at the National Institute for Pharmaceutical Research and Development before becoming Director General of the Nigerian Natural Medicine Development Agency. And it is a natural product from 4 Nigerian plants that we used to make a medicine for sickle cell called Niprisan. And I should also inform us that 40 to 60% of the drugs that we are importing into this country are made from natural products, from plants. We cannot continue to be market for other
What's
people.
your agency
That's
doing
the point.
to change the narrative?
Research and development, training in this area. Traditional medicine, one leg. Research and development, medicinal plant development on the other leg. And that's, in fact, there's a college.
It's a tripod.
Yes, tripod. There's a college approved, accredited by the National Board for Technical Education.
Is it functional?
Yes. Yes, our first convocation, maiden convocation, will be in October 2025. It started with this government, accredited by National Board for Technical Education. But that is research for development. That's why I'm emphasizing. Let us not mix research and development with interventional products of research and development.
Okay.
Yes.
All right, Professor, thank you so much. We know that if we give you 1 hour, you will talk for 2 hours. You are very passionate about it. Because of time, just your parting shot, Dr. Otabo.
Okay, thank you. It's obvious now that from the discussion that there's no universal health coverage without insurance.
Yeah.
And government needs to scale up investment in healthcare. Now, government should look beyond his children alone. Because when we talk about intervention, they are looking at government workers. What about the mechanic on the street? What about the vulcanizers? We need to incentivize healthcare. Let them see the benefit of it so that we can drag in as many people as possible. So that we can have universal healthcare. Otherwise, there's no
By the way,
way
it's not
forward.
just government workers that are children of the federal government. Everyone is.
Well, I use that in quotes.
I
use that in quotes.
Dr. Shirentire, just 30 seconds. 30 seconds. 30 seconds.
Thank you very much. Just to say that the Federal Ministry of Health and Social Welfare, under the current administration, is committed to driving the attainment of universal health coverage by ensuring that more of our population is covered, the service delivery that is available is of quality and affordable, and the financial protection we all seek for the low and medium income earners and their families are to be reassured with the interventions that come with the sector-wide approach to the Nigerian health sector investment initiative of the government.
Thank you so much. That'll be on another program, Dr. Camille. That'll be on another program.
Another time.
Thank you very much. We've run out of time. Thank you, Dr. Camille Shirentire, Director, Health Planning Research and Statistics Department, Federal Ministry of Health. Many thanks for being our guest. We do appreciate you. We're looking forward to what the budget will be like for 2025. We'll see that next week. And we want to also appreciate Dr. Chris Otabo, consultant orthopedic surgeon and CEO, Alliance Hospital, Abuja. Always a pleasure to have you on the program.
Thank you.
Thank you, and continue the good work that you're doing. Professor Martin Semije, you will have another program, I'm sure. My producer will arrange that.
A full program, actually.
DG CEO, Nigerian Natural Medicine Development Agency. Thank you. And of course, Dr. Olumuyiwa Olusonya, CEO, Insignia Health and General Secretary of Health Management Care Association of Nigeria. Many thanks for being our guest and joining us via Zoom all the way from Lagos. So that's our program this Friday. Take care of your health. I'm Yenwei John. Have a great weekend.
And I'm Ademola Adeye. Thanks for joining us and have a wonderful weekend.